Greetings and greetings, my fellow nurse brothers and nurse sisters. I know it's been a while. Welcome to the Medically Affiliated channel. I'm glad I'm back. I know it's been a minute. I've just been busy with personal things, but I'm back. Let's do this. Don't forget to follow my social media platforms, all my Nurse Mendoza platforms. So let's get to the very first question that I posted on Instagram, and it's talking about if you can only teach 3 things to a nursing student, what would they be? So I want to read all your guys' comments, as many as I can, in the next 5 minutes. Just because I want to just narrow it down to your main 3 top things. So basically I got over 140 comments on this question. So number 1, let's just read a random question. It says from Sarah Nurse Ebb, great name by the way. Always treat every patient with respect, every patient every time, especially in the worst moments. You are professional, you clocked in to be. I love it. Let's go to the next one. Take care of love and your maintenance for people who clean the room after discharge. Their hard work. I love that. Another one says take care and love your nurses' aides. They are pulled in all different directions. Another one is be humble. Just because you're a nurse doesn't mean you're better than anyone else. It's okay to argue with doctors, to advocate for your patients. Ooh, I like that. Let me tell you why I like that one. You treat everybody the same, especially the janitors, the people you work with, your colleagues, also the lab techs, the phlebotomists, x-ray techs. Everyone and every person that works in the healthcare field is definitely your colleague. So you're not above them or below them. You're just in the middle with them, and you got to treat everybody with respect. And also the cleaning individuals. My goodness, I love them because they do everything and anything just to get better for your patients. For the next one, get admitted. Okay, the other one I do like is stay humble and always know that you're not better than everyone else. I love that. It's kind of the same thing we said earlier. Let's go to the next one. By Lori6910 says, listen to your patients, take your breaks, use your break time to charge, quiet your mind even for a little while. I like that. Also, critically think through doctors' orders as they can be wrong. So you're always following through. Remember, you always advocate for your patient and always follow through. Ask other colleagues, other nurses, what they think, what they know about their critically thinking skills, about the patient, why they're there, and what are we doing to get them better as a care plan. Also, listen to your patients. I like that one just because they always have something to say, plus they have questions they want to know answers to, because the doctors, they're great, don't get me wrong, but they're very fast when they go on to the next patient just because they got so many other patients to do and care for. Also elaborate. If you have another question for the doctor, for the patient, ask them, write it down or communicate with the patient. That way there's always a set form for the patient to know what's going on, like I said, plan of care, and also why they're getting better and what they're going to do to get better to get out of the hospital. All right, another one says, self-care, know your worth. Money isn't your worth for your own health. All right, well said. I will say this, yes, definitely know your worth, because you are well worth for this position. Always know that this place you're always a replaceable individual. I hate to say that, but you always got to know your worth, know what you're bringing to the table, what you are capable of doing, know your goods, your bads, your ins and outs, and your pros and cons, if that makes sense. You always ask your colleagues too, or your coordinator, or your charge nurse, whoever it is that you work with, your manager, ask what you can do to be better as a nurse. The other one is self-care. I always say this, cardiac strong, go run. I like to run on my days off or do some meditation. That's always helpful so much. And also on my breaks, I don't go and eat in the break room. I just got to stay away from people for a little bit, do my little prayer, meditation, whatever works. That's always the best bet. So I always say that. Also, the last one is, okay, here's another one. Let's just go to the next one, guys. There's a lot of questions. Okay, or a lot of answers. Here's another one. Compassion, time management, and collaboration. Compassion, yes, you got to have this if you're going to be working with healthcare in the healthcare field, also taking care of patients. You also got to remember that your health does come first, because how are you able to take care of other patients if you don't take care of yourself? So I'm just saying, you can go out and take care of patients and proceed to educate them about comorbidities, diabetes, hypertension. But if you're hypertensive, you have diabetes, you have all these other comorbidities, huffing and puffing, out of breath, taking inhaler every 2 seconds, how are you able to communicate with your patients? They're not going to really, they will take you seriously, but they won't really listen quite as well as they should be, especially when they're patients, they're trying to get better. They want to, you got to practice what you preach. The other one does say time management, so important. I'll definitely say time management is so key, especially when you're admitting, discharging, transferring. You're doing all these for the patients, and also your level of care or your load of the patients could be really, really big and heavy. So you have these assignments that just kind of put you in a back burden when you can't catch up on charting or pass the medications, or communicate with the doctor. So many things you have to do. So definitely use time management as #1 priority whenever you're taking care of your patients. Ask for help, ask for assistance, ask your aides. Let's get some help. Also, collaboration. Communication's key. I always say communicate as well as you can. Doesn't matter if it's going to be to the point, but just communicate. It doesn't matter. Just get. Here's another one. Safety in terms of med administration. So follow the 7, 8 different rights they have for the patients. Time management, which we talked about. Number 3, the game politics of the workplace and how to not let a job undervalue or disrespect you. Very well said. And that's coming from Rosie Elise RN. Yeah, that's great. Like I said, I want to make this a 5-minute video. I'm going to do a part 2. I just want to do a quick speed through and do all of these comments that I have. That's only like 10 comments out of 140. So I'm going to do a part 2, maybe part 3. But anyway, my fellow nurse brothers and sisters, stay tuned. Please don't forget to hit subscribe. Go ahead and comment down below what you think I should do to make the video a little better. Yeah, let's get back to this. My fellow nurse brothers and sisters, love you. Peace, advocate, nurse grind. Deuces. Love you guys.